So let's get started. All righty. So you are participating in the presentation, which has the topic of improving self-management skills. My target audience is specifically for patients and caregivers, but of course, anyone is welcome to join and learn all there is to know about how to improve self-management skills. Just to share a little bit about me, my name is Stephanie Greer, and I'm a registered professional nurse by trade. And I've actually worked as a nurse for about 25 years. And I've worked in a variety of different healthcare settings. I've been a home care nurse, emergency department nurse. I've worked in mental health settings. I've worked with our nation's veterans. And I've learned a few things in my time providing direct care, and I'm delighted to have been invited to share in this presentation with you today. So again, our topic is improving self-management skills. So before we get started with the actual presentation, what I will invite you to do is to join in emptying your cup. Taking a deep breath, I want to try to create an environment that is as relaxed as possible. So if you can sit back in your chairs and take a deep breath, I'm going to play a breathing exercise for you. And this is your opportunity to relax and be present fully in the presentation. So give it just a moment to load. Okay, so I hope you enjoyed that 1 minute deep breathing exercise. And its purpose again is to try to make you as relaxed as possible. I want to get you comfortable so that you are able to ask me as much questions as possible. So my objective today is to hopefully within a 45-minute time frame, I want you to be able to engage as much as possible. So I've actually embedded opportunities for you to do so. So if you see on the screen this particular icon, I want you to put in the chat and respond to me, because again, the way you learn best is for you to be engaged as much as possible. And at the end of this particular session, my hope is that you will, at least from all the information that I will share, take away 3 important points. And that is be able to define self-management, to know the skills within the self-management journey, and to be able to identify the resources to help develop your self-management skills. And we're going to review this at the very end, just to make sure that you are able to take away these 3 very important points at the end of the session. So I am going to start the session with defining what is self-management. Now, before I share the 3 definitions that I have on the screen, I want you to know that I actually researched about 10 to 15 different definitions. And the one thing that I want to relate to you is that there's no one standard definition for self-management. It's not a one-size-fits-all definition. Many health professionals use the term in different ways, and depending where you are in your self-management journey, you'll have different focus. So the first definition that I want to point out here was actually created by Clark and colleagues. And they define self-management as the day-to-day management of chronic conditions by an individual over the course of an illness. Now, when you look at this particular definition, I pinpointed this one because it really speaks to how some healthcare professionals look to defining self-management. You can see here that the focus is more so on the disease itself, the day-to-day management of the chronic condition. Whereas if you look at the second definition, which was provided by the Center for Disease Control, it speaks to what self-management involves. They say that self-management involves focusing on an individual's role in managing chronic disease. So here you see their focus is more so on the individual themselves. Now, the very last definition that I want to point out here is one that speaks to an individual's behaviors. And this is something that I just Googled, Webster's Dictionary. Webster's Dictionary actually defines self-management as a management of or by oneself, the taking of responsibility for one's own behavior and well-being. Now, again, you see that each of these definitions may have different focus, but they have a common theme, and that is to focus on the individual. And one of the things that I want to share is that we understand that in your self-management journey, it can be very overwhelming and very daunting, but it's a process. And at the heart of each successful self-management journey is a process that helps you to minimize all the stressors that may be involved in cultivating your skills. So know that you are not alone in the process. You may be at the center of it, but you are not alone in the process. What's important is to be successful is that you're able to identify and utilize all of your social networks. Now, social networks, I specifically mean your friends, your family members, community members, and more specifically, your treatment team. And additionally, improving your self-management journey involves being able to have a relationship with your environment and being able to navigate the resources within your environment. Now, I'm going to talk a little bit more about some ways to improve your process when we talk more in depth about the skills. So now I'm going to try to keep you as engaged as possible. As you can see, the icon on the screen means that I want you to be involved in helping me to define what is wellness. How do you define wellness? And of course, there's no right or wrong answer here. I'm just looking to hear more so what you think. So put in the chat, tell me, how do you define wellness? And I'm going to give you probably about a good 10 seconds. Hopefully you're quick typists. So okay. So let me define wellness for you. Do I have anyone in the chat that may have put? Okay, I have Veronica who shared, I think of mental and physical well-being. Excellent. Donnie, thank you. Self-management is being able to be at peace whenever not feeling well. Susan says that self-management or wellness, more specifically, is about feeling good. Those are all excellent definitions. The one, I'm actually going to keep it simple here in saying that wellness is defined as managing healthy habits. So that's how I'm going to leave you with the understanding of wellness in the context of this particular presentation. Wellness is about managing healthy habits. And of course, there's lots involved in that. Dr. Bill Hetler actually described the 6 dimensions of wellness. And basically what this speaks to is how to holistically think of all of our dimensions and all of what we need to cultivate in order to feel wellness holistically. We're not just one-dimensional creatures, obviously. So we want to be mindful of all the things that we can focus on in order to cultivate who we are as people. So the first of which is our intellectual selves. So what does that mean? What does that look like, our intellectual selves? Well, Dr. Hetler describes our intellectual dimension as a person that has intellectual well-being, expands their knowledge and skills and seeks opportunities to share their gifts with others. Within this particular domain, this category, it infers that not only are we developing our own intellect, but it also emphasizes building and developing relationships with others. So that's your intellectual domain. Now, when we think about our social dimension, this speaks to an interdependence between others and with nature. Our social dimension encourages us to contribute to the environment and our communities. Here we want to think in context of maybe joining support groups or belonging to social daycare centers. Lastly, having a social conscience can translate into actions such as maybe recycling, cleaning, making sure that we have clean air and clean rivers and oceans. It's about our engagement not only with one another, but also with our environment. So now let's focus on our spiritual dimension, our spiritual well-being. The spiritual dimension recognizes our search for meaning and life's purpose. Spiritual well-being means having an appreciation for life and forces in the universe, It speaks to believing in something greater than oneself. Some people align this domain with religion, but others do not. Religion is not a must within this domain. What's important here is that you may see a person is looking for answers. They may ask the question, why? Why am I alive? Why me? So this spiritual dimension is something that we have to cultivate. Again, some people fill this need with religion, but it's about knowing that there's something greater than yourself. Next, we're going to turn our focus to the occupational dimension. So when you think about occupation, your imagination will probably relate to work for pay, compensation. So you may think of a teacher, a nurse, social worker, a bus driver. But here I want you to stretch your imagination because financial compensation isn't always a part of the equation. Think about and consider the extraordinary work and tireless efforts of a homemaker or a caregiver. We definitely can say they work, but they may not always receive compensation. So in this domain, work is associated with the efforts made in developing or building something. Equally important is the attitude about your work. How does your work make you feel? How does your occupation make you feel? This is something that you should think about cultivating. The next domain that I want to focus in on is something that you probably will hear healthcare professionals have their focus on, and that's the emotional domain. The emotional and physical, I think, out of all the dimensions that I'm speaking to today, you will see a primary focus in on, and I'll talk a little bit more about why that may be the case. But first, let's go over what does the emotional dimension look like in terms of cultivating? So emotional wellness communicates an awareness and acceptance of one's feelings. It encompasses the degree to which one feels positive and enthusiastic. It's your capacity to manage our own feelings. So an individual who has an inability to control their anger, who may have emotional outbursts, we say that they may not be emotionally well. They may need help with adjustments. So this is a way of thinking about your emotional dimension. Lastly, the sixth dimension that I will go over is the physical dimension. The physical wellness that we speak to typically equates with exercise and good, healthy eating habits. This is most often the focus that one thinks about. So when you think about the physical, the emotional, and all the other dimensions within the wellness wheel, we think about our whole selves and how we can better manage our healthy habits. So if we are not developing each of these dimensions, we are not developing ourselves holistically. And sometimes our ability to manage our health may be compromised. So another way to think about the wellness wheel and all of its dimensions is thinking of it as a hierarchy, one rung that relies on another. So when you think about the hierarchy of needs as proposed by Maslow, and some of you may be familiar with Maslow's hierarchy of needs, it talks about being able to reach your fullest potential. Now, of course, before you get to your fullest potential, Maslow's hierarchy of needs says that you have to have a healthy self-esteem. And this is demonstrated by respect for yourself and others, having feeling that you have status and recognition, feeling that you are able to freely engage and have freedom and liberties in what you do. And in order to reach your fullest potential, of course, you need healthy self-esteem. But before you get there, Maslow says that you have to feel that you are loved and you feel as though you belong. So it's important for you to think about in terms of your friendships, your family members. What is your sense of connection with those around you? Because without cultivating that feeling of being loved and being able to give love, Maslow actually says that you will not have a healthy self-esteem. Additionally, having a feeling of safety is essentially important to reach your full potential as well. So personal security, having employment, being able to put food on the table, having that security that you are healthy, that you're able to thrive, that you have property, a roof over your head, those belongings make you feel more safe and secure. And without that feeling of safety, obviously your ability to love and be loved, your feeling may be compromised, your self-esteem may then be compromised, and of course, you may have a challenge in reaching your fullest potential. So the last of this domain in the hierarchy of needs is the most fundamental level of being able to fulfill your physiological needs. And that speaks to being able to have clean water, food, shelter, sleep. More specifically, I'm going to touch in on those points because I made a point earlier in saying that in order to reach your fullest potential, you have to have your basic fundamental needs met. And you will see healthcare professionals more so focus on your ability to achieve healthy sleep, eat healthy foods, and so forth and so on. So when we think about our hierarchy of needs, we want to make sure that we are able to understand the pillars of health. Um, before I go into it, I want to actually ask you, what do you know? This is your opportunity to engage. How much do you know about wellness? That's what I want to check in on. So what is the recommended guideline for the amount of exercise a person should have? Put it in the chat. Let me hear from you. What do you think? Is it A, 150 minutes per week, B, 30 minutes per day, or C, both A and B? What's your answer? Put it in the chat. Let me hear from you. What is the recommended guideline for the amount of exercise a person should have? So I hear mostly everyone saying B, 30 minutes per day. I see someone said C. Anyone give me A as an answer? Okay, so let's find out what is the answer here. The answer actually is A, 150 minutes per week. And allow me to tell you why that is. So the recommended guideline as proposed by the CDC is that we have 30 minutes of exercise at least 5 days a week. So therefore that of course equates to 150 minutes per week. One of the things that I want to emphasize here is that research says that there's no concern about how you divide up those minutes. You can do 2 15-minute blocks. You can do 3 10-minute blocks. It really doesn't matter as long as you get those 30 minutes per day, 5 days a week. So let me hear, what is the recommended guideline for the amount of sleep a person should have? Is it A, 5 to 8 hours per day, B, 10 to 12 hours per day, or C, 7 to 9 hours per day? So what's your best guess? Tell me how much you know. Put it in the chat. So I see C, 7 to 9 hours a day. Anyone believe something different? Someone says A, 5 to 8 hours a day. Anyone else? C? Okay, so let me give you the answer. The answer is actually C, 7 to 9 hours per day. Understand that this is the average that is recommended. So there may be individuals that need more sleep, and there may be individuals that require less sleep. But we want to emphasize that we recommend that you don't have anything less than 6 hours of sleep a night. And unlike the exercise guidelines, here we want to make sure that it is a 7 to 9 hour block in your day. We don't want to see you divide these hours because it's important for you to achieve REM sleep. That is rapid eye movement. Here, we don't know all the information as to how sleep drives our body and the way we engage. But we do know that if an individual does not achieve REM sleep, they will not feel as rested as they need to. So again, your strive should be for at least 7 to 9 hours of sleep per day. Your diet, let's talk a little bit about your diet. It includes, obviously, I'm sure you know, fruits and vegetables, whole grains, protein. There are a few websites that I'm going to go over at the end, but I want to emphasize here, this is the guidelines for a wellness wheel, that healthy person. And obviously, if a person has a chronic illness, they may have to engage with a specific diet. Now, the last of those pillars of health we discussed was stress management. So one of the things I want to emphasize is that it is important for you to follow the guidelines for sleep and diet and exercise. And this helps you to be able to manage your stress that much better. Engaging in activities such as deep breathing and meditation are also helpful ways for you to manage stress. The key is for you to be able to talk with your healthcare professional and learn different tools to help you manage that much better. So thank you for engaging, and we're gonna return to our definition that discussed self-management. We talked about the pillars of health and wellness and all of what it encompasses. But now I'm gonna shift our focus and talk a little bit more about the day-to-day management of chronic disease. Here, you are the center, you are the focus of that management. And we want to make sure that you have the tools and the skill sets to be able to take responsibility for your behavior and your well-being and engage in a healthier lifestyle. So an individual has to consider how to be well while living with a chronic disease. Diet impacts your illness, obviously. If a person is diabetic, they may see themselves having a diabetic diet or a low glycemic diet. An individual with high blood pressure, obviously low salt, a DASH diet may be indicated. And obviously low cholesterol and low fat is something that's recommended for everyone. And what we know is that chronic illnesses might impact your movement. So it's critical to have dialogue in terms of the intensity and degree of your movement. So it may structurally change depending on your chronic illness, and that's why it's so important to communicate with your healthcare professional. Chronic illness might also indicate the need for a caregiver, and we're going to talk a little bit about that and what all that encompasses as well. So what we know about chronic diseases is that it is the primary reason for seeking healthcare. It is also the leading cause of disability and death in the United States. It is a long-term viewpoint, a long-term journey. And what I mean by long-term is that at least 6 months or more. It could be a lifetime. And when you have these chronic illnesses or diseases, it can be very daunting, it can be very overwhelming, and it can lead to a lot of uncertainty. Additionally, it can also possibly be very intrusive in your lifestyle. So I lost my screen there for a bit, forgive me. Okay, so when we talk about living with a chronic disease, we also want to keep in mind that an individual might live with one or more chronic illnesses. And what we have learned is that prioritizing self-care is important, but it may be a challenge for someone who lives with a chronic illness and, of course, multiple chronic illnesses. When the number of self-care activities or tasks to accomplish surpasses the amount of time available, patients will establish a daily plan around the management of just the chronic disease. And of course, their self-care may deteriorate. So knowing and understanding your resources is so critical to help you better manage the process. So we talked about the individual domains of or themes of self-management. And this particular definition speaks to all of those themes collectively. How can we think of self-management in the face of chronic illness? So this one definition says that the practice of activities that individuals initiate and perform on their own behalf in maintaining life, health, and well-being, and developing the skills needed to devise, implement, evaluate, and revise an individualized plan for a lifestyle change. So these are all the facets of self-management in the face of chronic diseases. And of course, I want you to keep in mind that one particular definition. So now thinking in terms of, I've been diagnosed with a chronic illness. What are the skill sets that I need in order to better self-manage this particular illness? So what we've learned, and this information comes from Dr. Schulman Green. She proposed that these are the skills needed within the self-management journey, being able to make decisions. And I want to emphasize here that it should be shared decision-making. So it's one thing that we've learned over time is that the healthcare system can be very paternalistic. That is, we tell you what to do, we expect you to follow. But now the emphasis is more on you being able to develop skills so that you're able to be more engaged. So we want to hear from you. It's important for you to communicate how this self-management journey is impacting you. Obviously, you need tools. You need tools to be able to take action so that you're better able to manage your journey. Those tools should come from your treatment team. That patient-provider partnership is so very important. But I also want to emphasize here that it is a team level approach that should be necessary. Oftentimes we rely very heavily on the provider that's providing our care. But if we take the chunks that's provided by the specialists that are involved, we are able to get the most evidence-based information, and we're able to have reliable resources and a variety of different ways of managing and approaching building our skill sets. Another thing is self-tailoring, making it individualized. And that means that you have to be the person to speak up and communicate. How is the illness impacting you? What are the ways the treatment plan can be tailored to meet your dietary needs, your movement needs, and all of those domains that we spoke of a little bit earlier on? It's about knowing what resources, how to utilize your resources to make an individualized plan for yourself. And when things happen, as we know they will, being able to troubleshoot and problem solve. But it takes skills, it takes having the tools and resources to be able to do that. So you should be able to tap into knowing how to better improve your own health and engage so you have the best quality of life that you possibly can. So our hope is that you will have the basic steps to be able to feel empowered enough to better manage your health, to possibly keep it under control, to have it as a separate entity and not have it define who you are. But of course, as I mentioned, it takes skills. It takes knowing your disease, understanding how it impacts you, being able to apply the treatment plan and reevaluate it so that it is giving you and providing you with the resources that you require. Another thing here I want to emphasize in that process is understanding that you can live in wellness despite having a chronic illness. This is a very important perspective to have. As you can see here on the slide, I have a picture of client, and what I hope to do is to find the perfect picture that speaks to an individual who lives in wellness despite a chronic illness. But I thought to myself, this should be your vision. You should be looking at your own lifestyle, looking at what you hope to accomplish and inserting that picture. In order to build this mantra and live it, it requires lessening your focus on your illness. And again, that's a process. In order to make it through, to be able to accept that you have a chronic illness, we know that sometimes you may engage in denial. Sometimes you may be very angry that you've been diagnosed with a chronic illness because, of course, it can be very intrusive. You may engage in bargaining and asking, why me? We talk about intellectual well-being in all of our domains. So when we are faced with having a chronic illness, we have to think about how to best manage it, and how to adjust to integrate the illness into your daily life. So again, I want to focus on the skills to do that. It requires knowing your disease, having a name for it, not having it define who you are, understanding how that disease impacts your body, impacts your life, being able to articulate it, getting an understanding of the treatment plan in order to manage it, and also being able to apply that treatment plan. Looking and engaging and reevaluating over time such that you are creating a plan that meets your needs. So these are the tips, the very basic tips that I came up with. So when you're having that communication with your treatment team, be empowered enough to ask questions. Sometimes that may be a challenge. We as healthcare professionals use language that may go over an individual's head. They may feel reluctant to ask questions, but we want to encourage you. This is your time. It's about you being the center and at the focus of the care plan. We want you to be patient in the process. Be patient with yourself and be patient with those around you. As we're trying to figure out the best management plan for you, obviously being consistent in following through with the treatment plan and communicating when it's not working, because you are the best knower of yourself. We healthcare professionals are not mind readers, but we want to make sure that we are trying to tailor make treatment plans for you to best meet your needs, but we need to hear from you. And of course, you have to be consistent in engaging in your treatment plan. So what have we learned? Obviously, it was a learning process in terms of how to build an appropriate client-provider relationship. And these are the attributes that we've learned patients and clients think about when they're thinking about a provider that's best suited for them. So as you can see on the icon, I want to hear from you as I'm reading through the attributes of a sharing provider. A sharing provider, tell me, what is your preference? This is a sharing provider is defined as one who is an active listener, a person who asks open-ended questions such that you're able to share and communicate. A sharing provider is a person who is very clear about their goals and is able to communicate it to you such that you understand it. So tell me, what is your preference in those particular attributes? Tell me, put it in the chat. Also, we've learned that clients prefer compassionate providers. And they define a compassionate provider as one who is attentive, giving, empowering, one that makes them feel that they're able to ask questions, that they're able to take care of themselves. So if you think of the little engine that could say, yes, I can, yes, I can, yes, I can, it's that provider relationships that make you know that you can, and they give you the tools to be successful. So a compassionate provider is also defined as one that is a relationship that's based on trust and the client's feelings. Additionally, someone who is sensitive, one who observes, perhaps alertness. So if I share with you a concern or share with you any information about your diagnosis, A sensitive provider will be able to pick up on the fact that maybe you need further explanation. But again, here I want to emphasize how important it is for you to communicate your concerns. A sensitive provider is one that is able to provide comfort in the presence of family and is also aware of communication barriers. So these are all the attributes of the providers that clients look for. So tell me, what are some of the attributes you look for in a provider? Active listening, all the attributes I see, being clear. So these are some of the things that you look for in a provider. Okay, so let's talk a little bit about utilizing resources. So when we think about, and I've gone over some of these dimensions. So utilizing resources means knowing the family members that you can rely on and be able to tap into to perhaps sit with you in a provider appointment to perhaps help you understand better. Perhaps maybe the provider is, or perhaps I should say, you may have some cognitive impairment. Perhaps the chronic illness that you deal with makes you very fatigued throughout the day. So when you go to your provider's appointment, you may not be able to understand or remember everything that's shared with you. So think about the family member that is able to accompany you. And know that, of course, family is not solely a blood relative. It's someone who you believe can be supportive and helpful. It could be a friend in the community, a church member. Another thing that we want you to recognize is knowing that your healthcare professionals are resources for you. So tap into them. Know your provider, know your specialist, your nurse, all of the individuals that can help you along your journey. Additionally, know your spiritual resources. We talked about cultivating our spiritual dimension, and this helps you to answer why. Perhaps maybe it gives you focus and helps you to be able to push through the chronic illness that you're dealing with. And lastly, in utilizing the resources, we want you to think about your social and transportation resources. And this, of course, helps you to gain access. So we want you to think about what are some of the resources that will help you get to your appointments, help you to be involved in the community so that you're not socially isolated, because you can live in wellness in the face of a chronic illness. So I want to talk a little bit more about some resources that I would like you to know about. I think most people are more knowledgeable about how to use the wide world web, but it's important for you to know that all of the resources that are available over the internet are not always evidence-based. So you want to make sure that you're given credible information. So the websites that you look for a .gov exchange. So look for .gov at the end of the website, or .edu or .mil, which stands for military. So these are credible resources that you can believe and have confidence that they're giving you reliable information. So some resources that I want you to know about is Medline. They provide easy to read health information that is specific for healthcare, health consumers. That's very basic, simple. They try to write their materials so that there's less challenge in understanding the information. So there are some additional websites that, of course, I want you to be familiar with. For the public, NIH.gov, Medline Plus. You can also learn about how to be more healthy. So those pillars that I spoke to about sleep and diet and exercise, knowing the guidelines. And of course, if those guidelines are updated, you'll be able to tap into these websites to learn the most up-to-date information. Also learning about immunizations that you may need to take to stay in your wellness journey, even in the face of chronic illness. So all of what you need to learn obviously is available on websites, but please have partnership with your healthcare teams, because obviously they have gone to school for many years, and they can help make sure that you're understanding the information that you're reading over the internet. So as I stated a little bit earlier on, I want you to have these takeaways. Hopefully, you are able from this presentation to define self-management. And I want you more specifically to take away the definition that it involves focusing on an individual's role in managing chronic disease. So this is more so about you and how you can be more engaged and involved in helping yourself manage your chronic illness. So the second takeaway that I wanted you to have is to know the skills within the self-management journey. So we talked about having decision-making skills, being able to create an action plan with your treatment team, developing a good relationship and knowing the attributes of the provider that you're looking for, being able to tailor make all of those treatment plans, making it individualized so that you're able to see yourself engaging on a regular basis. Being able to utilize all the resources that are available to you, and having the tools to be able to problem solve, because we know that challenges will exist. So being able to navigate those challenges, being able to tap into the resources to help you cope through the challenges is so very important in your journey. Lastly, the thing that I want you to take away is to be able to identify those resources. Who among your family members can you rely on? And of course, it doesn't have to be a blood relation. It could be a friend. It could be a church member. Knowing when you go into your primary care facility, knowing your treatment team. As part of VNS&Y, we offer you resources as well. Do you know your resources? All of the resources that we have available for you. So I'm going to take you to that QR code. And again, I encourage and invite you to learn about all the resources that VNS&Y has to offer to you. Additionally, you want to know about the community resources that you have, as well as any spiritual advisors. So those are the three things that I want you to be able to take away from this. Hopefully, I was able to keep you as engaged as possible. I talked about that QR code, and if you'd like to take the opportunity to scan to learn all about the resources as I go through who we are at VNS&Y. So VNS&Y is New York City's largest not-for-profit home and community-based healthcare organization. Our mission is to improve the health and well-being of people through high-quality, cost-effective healthcare in the home and the community. We provide care to at least 44,000, more than 44,000 patients and health plan members on a daily basis. And our community outreach programs serve various populations, including veterans, Chinatown Community Center, hospice outreach, patient and provider education, also known as HOPE, and New York's LGBT seniors. These are our outreach programs. And again, if you want to learn more about our resources, please take the opportunity to scan that QR code. So we have about 5 minutes left. I want to leave this opportunity to ask me questions. If anyone has any specific questions for me, please feel free to use the chat now. I'd love to answer any questions that you may have about your self-management journey. Okay, so you may also see in the chat, please pay attention to the website, vnsny.org, community collaborations. You can tap in to learn more about our offerings as well. So do we have any questions from the audience? Any questions for me? Give you a minute to type. Okay, I see I have one question. Someone says, thank you, and you are very welcome. I thank you for inviting me to give this presentation. Hopefully you've gained some insight in terms of how to best manage or have self-management focus in your wellness journey. Any other questions for me? Okay. Thank you to each of you. I appreciate the feedback. So Joseph, do you have a question for me? So that's a question that I want to give to members of the community collaborations team in terms of slides. I'm not familiar with any certification that's offered, so if someone can take that question, can we offer them the slides that that we have here?
Thank you. Thank you very much, Stephanie. Joseph, to answer your question, so we don't have certification for the attending this presentation, but the recording of the presentation will be available and uploaded shortly onto our Community Collaborations Vimeo showcase. And we will drop the link to the showcase in a few minutes if you could just like hang on. But unfortunately, there is no certification, but we will have the recorded copy of this presentation available for you on the Vimeo showcase. Okay, thank you very much and you're welcome. So I'll drop that in for you in one moment.
Okay, so are there any other questions? We have about 2 minutes left. And Veronica shared the showcase link. So if you want to access that showcase link, and of course, you still have the opportunity to scan the QR code, please feel free to do so. We want you to have as much information as possible to be able to navigate your journey.
And Joseph, that recording will be most likely updated onto the Vimeo showcase by next week. Okay, but it also has the other presentations that we have done for the community. And thank you everyone for attending, and we'll end the webinar now. Thanks again, Stephanie, for your time and sharing all of your knowledge with us.